Hello and welcome to InnoHEALTH magazine podcast. I am your host Dr. Soumya Singh. In today's episode, we will be learning about forensic medicine, and this is the third episode and last episode of the series in forensic medicine. So in today's episode, we will be learning about forensic medicine specifically in the field of nursing. And to help us understand that, we have Dr. Rakesh Kumar Gorea. So Dr. Rakesh Kumar Gorea is professor and emeritus and an advisor. He is also a former registrar and executive director at Medical Legal Institute of the Medical Legal Institute at Baba Farid University. He is widely regarded as father of forensic nursing in India. Dr. Gorea has been a pioneer integrating ethics, education, and social justice into forensic medicine. He has trained professionals across the globe and continues to lead efforts in child protection and medical legal reforms. So we welcome you, sir. Thank you so much for giving us time.
Thank you, Soumya.
So, sir, I would like to start that you are we have just known that you are the father in forensic medicine, specifically in nursing. So, what motivated you to build this bridge between medicine and legal care, and how it is helping, in sensitive cases like domestic violence and child abuse?
Here is a very good question, and I will like to say that first time in 2002, I happened to listen to a lecture of Virginia Lynch, who is known as the mother of forensic nursing science in USA. She came to India, and that ignited something in me that if it can be done in USA, why it cannot be done in India too. With that motive, I started working on this field to develop the forensic nursing science in India, so that the forensic nurses, which are big number in India, if they get the proper forensic education, then they can be very useful member of the team dealing with the medical legal cases. Keeping in view that first we started from Punjab, then we went to North India where this was established. Then we worked in the other parts of our country, and then gradually we started working in the different countries of the world to develop this forensic nursing science in the different parts of the country, so that they can be the useful members of the profession, they can be the useful member of the team dealing with the medical legal cases.
Sir, as you mentioned that about forensic nursing, so could you tell me what's the scope and what's the role of nurses in forensic medicine?
Forensic nursing science is a separate discipline, and they have got a very big role to play in the medical legal cases.
Okay.
And they have, every country has its own laws, every country has its different needs, every country has different circumstances. So keeping in mind our country, what I visualized, the role of the forensic nurses in India, they can work in different scenarios. I will just enumerate those different scenarios. We are doing the post-mortem examination. Nurses are in all the other departments except this department.
Yes.
So we visualize that if they are in the post-mortem examination room, in the mortuaries, they can receive the dead body in a very good manner. They can help in the initial documentation of bringing the cases. They can deal nicely with those persons who are accompanying the dead bodies at that time. Police officials are also coming. They will deal with them because they have very good communication. Usually we are seeing sometimes even that is better than the doctors.
Yes.
So this, I want to utilize their power of communication so that the things can be in a better way as they are today. They can further help in the process of dissection of the dead body. They can be trained for that purposes, and ultimately they can be very helpful in reconstructing the dead bodies when they are they are badly mutilated. We have done so many cases where the nurses were involved, and the final outcome was much better in those circumstances. And ultimately, after the doctors, they do the post-mortem examination, how the dead body is ultimately handed over. So usually that is not handed over in such a manner that it should look very good. It is just optimum, but I want it to be the best, so that they can be even keeping in view the culture, keeping in view the religion of the person. They can be destined those things. Their faces are mutilated, they can be reconstructed. Even their teeth are broken, they can be, artificial teeth can be put on those places, so that finally when the body is given back, it looks nice to all those relatives, all those grieving persons. So it will look, in my opinion, if we hand over the dead body in this manner, it will be a big service to the society and to the family members.
Since you mentioned about tooth, there is a role of...
This is just one example.
Yes.
If you wish to know the others, I can...
Yeah, sure, please. Please.
So similarly, in the emergencies, there are persons are coming who are badly injured, who are taken poisons. Again, their relatives, they are feel a lot of trauma in those situations. So how to deal with those persons?
Yes.
And when giving first aid, so the evidence which is present there, so that is not diluted or get lost in those process. So forensic nurses, they can also play a very big role in those cases. Simultaneously, there are other things which they can do. They can help in all those cases which are sexually assaulted.
Yes.
They can help in receiving those cases, documenting those cases, identifying the proper evidence, collecting of that evidence, preserving of that evidence, and handling that evidence ultimately to the police officials, maintaining the chain of evidence. And simultaneously, they can take the psychological care of all those persons who are involved, because they are trained for this and they can be very good. In addition to this, they can do the child abuse cases. They can help in a lot of ways, because you see that child abuse is just not limited to outside. It is in the schools also, in the form of corporal punishment, as well as at the home. There is a corporal punishment is to the children, and they are not only physically punished, they are psychologically abused also. And I think the psychological abuse even is more harmful as compared to the physical abuse. And our forensic nurses, they can play a big role in identifying those cases, in reporting such cases, and what should be done, and even providing the psychological support to the victims and their relatives in those circumstances. They can. So this is not limited to child abuse. Even in the old persons are being abused. Old persons are being abused at hospitals because of their demand. The person may get irritated. There may be physical violence, or there may be neglect of these old persons. And these old persons are not abused only at the hospitals and the old age homes, as in India we have old age homes, but this is sometimes even occurring at our homes also. Even homes also, there is so much of abuse. So who will identify this abuse? Who will take care of this? So the forensic nurses, they are specially trained and they can take care of this abuse. In addition to this, they can work with the police at the time scene investigation, where they can help in the collection of the biological evidence. They can work with the lawyers so that they can frame the cross questions. They can work with the insurance companies so that nobody gets the fraudulent access money from these companies. So these are just not the exhaustive list. This is the main things which I have given. In addition to this, there are so many other things they can work. There are occurring mass disasters. There are identification problems in those cases. There are refugees. there are child traffickers.
Yes.
There are persons in the jails and prisons, they are being abused and they are being tortured sometimes even. So the forensic nurses, they can go there and can identify and can work on for those innocent persons. And in this way, a lot of good things can happen to the society, and society will be benefited by the work of the forensic nurses.
So definitely, like from your example, there's a very good scope for the in this field of forensic medicine for nurses. So I would also like to understand that you have trained internationally the students in India and abroad as well. So what kind of study difference is there in India with respect to abroad?
In USA, mainly the forensic nurses, they are working at a few places. They are working for mostly as a sexual assault nurse examiners. They are taking the samples of the cases who are sexually assaulted, and at very few places they are at the in the mortuaries, and at some places they are working at the crime scene. So these are the three main areas they are working. But for India, we have visualized so many different areas which I just enumerated to you. So this is the basic difference. I always say that whatsoever is there in Western science or Western countries, we should not blindly follow them.
Yes.
We should see the situation of our own country, and we should modify the things according to the needs of our own country, and that is what we are trying to do.
Yes. So, ethics play a huge role in forensic cases. So, have you ever had the situation where medical facts conflicted with the legal or social expectation?
Ethics, they are very, very important, because in forensic science, if ethics are not there, probably nothing good will come out of it. If the person is not honest, person may be biased due to one reason or the other, the facts which should be brought out, which should be collected, they may not be done properly.
Yes.
And then the whole aim of the forensic science that will be diverted, and probably the person will not get the justice in those circumstances. So it is very, very important, ethics. If we will just talk about ethics to our students, it will not work. We have to be the role models. First, we have to show to our students that how we should behave, how should we carry out our work. And then our students, even without teaching them, they will absorb those things, that honesty is a good thing. So that is my view, that honestly everything should be done, whether it is a medical field, whether it is a nursing field, whether it is investigating field in the police officer officials. So all should be honest, only then some useful things can be come out of it.
So, since you have to go to courts, you have to testify, that's a part of your job. So, do you face any common challenges in the courtroom, while presenting a very complex medical cases? Do you feel any kind of challenges?
Yes, at our age, probably we have overcome all those challenges. But for all those new persons who are just starting the practice of going to the, they will have challenges. As we were when we were younger, we also faced those challenges, and then gradually we learned how to overcome all those challenges. But one thing is, you go to the court and there a lot of time is wasted. The proper time is not given, that you come at this time. They usually called in the morning, and sometimes we get free in the morning, but sometimes we have to sit till the evenings in the morning. And then probably this is the biggest challenge. And if we are ethical, then nothing is going to be out of it. But if somebody is asking you, there is cross questions. Most of the people, what happen, they get afraid during these cross questions. But I always say to my students that once you are honest, once you are done that thing scientifically, you are the man of science. You are not for this party or that party. So whatsoever the truth is there, you should speak that truth in the court, and you will not have face any problem in those circumstances. Another problem usually what is that sometimes it is sometimes the person is summoned in the court and they are not given the travel charges.
Okay.
So mostly this is a very big problem, and ultimately when you are summoned, you have to go to the court, but court sometimes, most of the times, they are not able to compensate for the travel charges even. So this is just one of the issues, and it is not at all the places, but at some places this challenge is there. And I will always advise my students that when you go to the court, you should dress nicely, and you should speak respectfully, you should be punctual, go well in time, you should take all the records with you. But you have written, you should not go against that. But maybe you are speaking something, you are giving the answer something, but you have not thought about that this can happen. If somebody is saying that can it happen, you think about that, and if it can happen in that way, don't be afraid to say in that way. Yes, that can happen that time, as is suggested by him, because previously you may not have thought about it, but you should always speak that truth. What you think is scientifically correct, you should only speak those things. No emotional bias, and no bias of any type of pressure or persuasion. You should speak the truth, the whole truth, nothing but the truth.
So one last question, which is like, what would you like to change or reform in the field of forensic medicine practice? It can be training, it can be equipment-wise or legal awareness or something else. What would you like to change?
Yes, the most important thing is the biggest work with the forensic medicine people is doing the post-mortem examination.
Okay.
And when the post-mortem examination is being done, the cleanliness of that place, I will say that is usually not maintained in a manner it should be done. If the forensic nurses are there, it could be maintained at that level as it is being done in the operation theatre. So that is one, so that we can take care of that ourselves, those coming to the mortuary, the persons who are working in the mortuary, they are not exposed to harmful pathogens in those circumstances. So this is one of the things. And the post-mortem examination should be done by the trained persons. So sometimes it happens that fresh graduates, they are put on those post-mortem duties. First, they should be properly trained, and somebody should monitor whether they are able to write the good reports, they are able to do that, and after it is certified, only then they should do the post-mortem examination. So preliminary training of the medical officers, that should also be done in these circumstances. In addition to this, they are doing so many other things. The clinical forensic medicine. So for all rape cases are done, the poisoning cases are done, the injury cases are being done. So they should be properly trained for that.
Yes.
Before they are put on the duty. So ultimately, the outcome will be that.
So thank you so much, sir. Thank you so much to our listeners for tuning into InnoHEALTH Magazine podcast, and do like, share and subscribe to our channel. Thank you so much.